Ladies and gentlemen, good morning and welcome to Dubai Chamber Sustainability Network Task Force on Employee Welfare and Wellbeing. Today's webinar is deals with a very important topic. That's the factors affecting mental health at workplace, science and coping mechanisms. I think there is no doubt that, and we all agree that this is a very, very important issue, and it's becoming more important in the current pandemic environment. Workplace mental health is a public health issue, but it is also an economic and a business issue. It's very important that employers should know about the prevalence of mental health problems and the cost of mental health care to business. And when they do so, they can make the necessary changes to the work environment to support the well-being of all of their employees. There is overwhelming evidence that depression, for instance, if left untreated, may have a significant impact on work performance of the employee and his or her peers. There are some estimates that suggest that major depressions alone in the US is costing employers around 31 billion to 51 billion per year in lost productivity. And the World Economic Forum reports that by 2030, that's in about 9 years, the global cost of mental health problems will total over $6 trillion. An employee with depression, according to some studies, miss out about a month, 27 days of work per year compared to their peers without depression. And it's not only about absenteeism, it's the issue of presenteeism as well, which is very, very hard to detect. And it occurs when employees are not fully functioning in the workplace due to problems with time management, concentration, physical tasks, attention to details, communication, all this because of the mental health issues. But above all, this is human issues and the responsibility of employers to look after their employees. And the COVID pandemic has exacerbated this issue, as employees are reporting anxiety because of job security, stress due to change in the work routines, feeling of loneliness and isolation working from home, and some having difficulty of work-life balance while working from home as a result of the COVID-19 pandemic. So this is a very, very important issue. And it's a pleasure to have very distinguished speakers today with us to help us understand the factors affecting mental health at workplace, the science, how do we spot them, and the coping mechanisms for employees. So please join me today in welcoming our speakers, Dr. Jaina Boraslan, Lecturer of Education Psychology at University of Parliament, Dubai, and Head of Educational Psychology Department at Nafsa. Lakshmi Montgomery, Employee Relation Manager at DevSco, and Dr. Majid Iskander, Head Health Sciences at Nestle. Now I invite Dr. Sangeeta Sharma to run short poll and take it from here. Over to you, Sangeeta.
Thank you very much, Dr. Kamal, for your very insightful presentation and introduction to the topic. I'm sure it has set the stage for today's discussion, where our presenters will be presenting on the importance of mental health, the various factors affecting, and science and coping mechanisms. So now, without taking much of your time, I would like to start a poll for our audience before we start with the speakers. And here are your poll questions. So please answer these. The first question is, do you think maintaining a good mental health of employees will improve workplace productivity? Dr. Kamal has just mentioned about it. Would you like to suggest mental health to be a topic of discussion to continuously improve workplace environment? In your opinion, is mental health an individual responsibility or collective responsibility at workplace? So please take the poll. So people are still responding, so we'll wait for everyone to respond. Yes, we are getting some good responses, some very good results. I'll soon share with you. And we have some very interesting results. So 92% of the people have said that yes, maintaining a good mental health improves workplace productivity. 98% of people have said that mental health has to be a topic of discussion at workplace. And very interesting, 16% of people have responded that it is a collective responsibility. 1% said individual responsibility. And 83% of the people have said that it's both individual and collective responsibility. And these results actually very clearly indicates that yes, it's not only an individual responsibility, but it's a collective responsibility. It's a collective responsibility at workplace of also the line managers, the employer, the colleagues, the team. And that's what makes this webinar all the more important, because the results also shares the same, that it's a collective responsibility at workplace. Thank you very much for taking the poll. And now I would like to invite our first speaker, Dr. Jaina Boraslan, to please take over and present on mental health.
Thank you so much, Dr. Sharma. Thank you, Dubai Chamber Sustainability Network, for hosting this important session. My name is Jaina Boraslan, and I'm a professor of educational psychology at the University of Balamand in Dubai. I'm also the head of educational psychology department at a mental health center called Nafsaniyun. I'm very happy to be here with you today, and I welcome you all. Our topic is valuable, and we need to keep the conversation open about mental health, especially at the workplace. Why? Because we have 24 hours per day. So this means I have 3 8s, 8, first 8, and the second and the third. So your quality of life depends on these main factors, basically. The first 8, where are they? Usually in the workplace, if they're not extended, that is. The second 8 hours at home, your social life, your personal life, and the third 8, which is not so well spoken of usually, it's your quality of sleep. Allow me to be the professor that I am and use some of my pedagogical approaches to pose an important rhetorical question. Mental health, what does it mean to you? I'll write it on this whiteboard behind me to grab your attention to something really significant. So, I don't know if you can see this, but it says mental health. It's important for men, but not just for men. If you know Arabic, you can add a waw, harf al-waw, or women. So it's important for men and women. In this attention grabber, my idea is that no one is not prone to having mental health issues, despite the age, the race, the gender. Next slide, please. Oh, we're already there. Okay. So to respond, sorry, we need to go back. Great. So to respond to this rhetorical question, the definition of mental health, it is, as you can see, the state of well-being where you can be productive, happy, you feel secure, you deal with any source of stress without major limitations to your work and life, and you contribute also to your community. So it's more than simply the absence of illness, because it's an active state of well-being rather than a passive, the absence of something. Next slide, please. Okay. World Mental Health Week, the World Mental Health Week is on October 10th. It's celebrated because we need to bring awareness to mental health in general. But in the UK, the UK Mental Health Week is next month. It's May 10 to 16. And this year's theme, I thought, is worthy of sharing because it's nature and the environment. So for the Sustainability Network of Dubai Chamber, I think this is a great meeting point. Nature, environment, what else can promote well-being? The evidence is clear that access to nature is crucial for our mental health. And millions of people discovered that during lockdown in the past year, in 2020. However, this was not the same for all of us. Mental Health Awareness Week 2021 will explore what the barriers to accessing nature are. And I will explore that in my 15-minute talk in the context of the workplace. So are you ready to embark on this short but exciting journey? What factors, not determinants, play a role in our mental health? Some of you may say, look, it's your genes, and you are right. Some of us are more ready to be resilient from a biological standpoint or predisposition. And yes, they're lucky. For example, some are born with a higher level of confidence, and therefore they may face or confront challenges with more ease than others. While another category might say, no, it's not your genes, it's the environment, the conditions of which people live by, etc. It's the forever clash between this nature and nurture. For researchers, we're always asking this, specifically for human sciences and in the field of human sciences. Nature, is it nurture? But guess what? Another category of people might say, okay, mainly what determines the quality of your life and therefore your mental health state is the quality of connections, the connections that you make, your sense of belongingness, and all these affections and love feelings that you have. So who is right? Let's find out in the next slide. Thank you. All of you are right. All parameters impact your mental health, the biological, the environment or the environmental, and your sense of community, love, and affections. So the model, as you can see in the poster, the model is an integrated one, not seen separately. And this model is fundamental to us. And we will see why in the slides that follow as we explore the context of the workplace and mental health and why we should have this in a holistic manner. Next slide, please. Okay. Allow me to share some numbers and statistics here because numbers do speak. In regular times, that is not in COVID times, in regular times, 1 in 5 people will experience a mental health illness over a year's time. So can you imagine what's it like during COVID times? I'll share some more numbers from a 2021 report published by Oracle on mental health. Okay, they surveyed around 12,000 people from almost 10 different countries. And the results? 70% of the global workforce say 2020 was the most stressful year ever. So almost 3/4 of the people being surveyed. And just like COVID-19, the mental health crisis takes on different shapes and sizes across every job, every generation, and geography. Now, 76% of the people believe that their employer should be doing more to protect their mental health. I'll speak now directly to HR specialists, and I'm going to address the issue of Millennials and Generation Z. Generation Z reported the highest mental stress rates with an estimate of 90%, saying the pandemic has negatively affected their mental health, followed by an estimate of 80% for millennials. So they're the most affected. Now, C-level executives are the most open to mental health, but guess where from? They want to get help from AI and not from humans. So they are open, but it's conditional. Generation Z and millennials are really hustling harder, but suffering more and seeking support because it's in their culture, generally speaking. In the countries where workers were hit the hardest, employees were most open to welcoming AI support for mental health. But no two countries had identical experiences of mental health issues during COVID. Now, I invite you to think of the implications of such findings on companies and organizational behavior, and perhaps more so, your own company. Is it fear of judgment from another fellow human? Is it the inability to feel vulnerable? I'd recommend to watch the TED Talk by Dr. Brené Brown on the power of vulnerability. She's a researcher on guilt, blame, shame, and also another TED Talk by Dr. Alana Connor. If you'd like later on, I can share the links. She's a researcher on cultural differences. And the highlight of the talk is that in the workplace, specifically in cosmopolitan cities like Dubai, for instance, it's a melting pot, men don't seem to invite much for interdependence, to get people to work together regardless of their age, gender, race. And women don't insist, they're not as assertive as they should be. This is to highlight the importance of both qualities and keeping an equilibrium, really, of interdependence as one factor and of assertiveness as another. These are two qualities much needed in the workplace. Next slide, please. Now that we looked at numbers, let's look at where the money and the budgets are going. On average, countries spend only 2% of their health budget on mental health, just 2%. So people are 10 times more likely to end up in prison rather than in a facility to give them the care they need. Countries where COVID-19 has affected mental health the most, let's talk about them. Can you guess? First, it's India. So it's 90% almost, it's 89 to be exact. And the UAE comes next, it's 86%. So people are really affected by COVID. And the countries that are least affected, Japan, Germany, Brazil, Italy. These are just numbers to think of who's affected the most and why we should really here take it seriously. Next slide, please. All right, promotion of mental health. How and where do we start to enhance our quality of life, emotionally and socially, mainly? You can start today at any point you choose, whether you choose to start with the whole workplace that you have or a selected group such as, for instance, the younger staff or let's say females, it's up to you. Your company can start working towards this target throughout a nearby school, homes of the staff that you have, personnel, or the workplace holistically itself. Mental health promotion is important for all of us. And whether or not you're diagnosed or someone else is diagnosed with a mental illness, this is irrelevant. It's all important for all of us. So we're all in this together, specifically in the pandemic. Next slide, please. Okay. Here, we're going to talk about actionable steps towards empowering mental health in the workplace. So, actions to prevent the onset of mental health illness or mental ill health in the workplace can be on a holistic level, the whole workplace population, including their families and community. Or you can also take actions specifically for people with higher risk in your community, in the workplace community. Or also, you can take actions to identify and intervene early, the earlier the better, they say, for intervention, with individuals showing early signs of mental ill health in the workplace. The fourth step that you can take is to take actions to support referrals. So you can refer people to get the appropriate treatment, and then you expect them to come back to work, to normalize this whole cycle. And number 5, you can take actions to reduce the ongoing impact of mental ill health on individuals entering or returning to work, because we need to normalize it. So we need to reduce the impact of mental health or ill health. And lastly, which is a major step, okay, actions to promote mental health and well-being in individuals experiencing or recovering from a diagnosed mental illness in the workplace. So here I put 50% of the magnitude of any action you want, whether it's your budget, you want to allocate some resources. This last step is crucial, is really important to take care of. Next slide, please. Okay, so to analyze the previous slide and sort the information out in categories, you're either reducing risk or promoting recovery, okay? In risk reduction, you may support good health, reduce individual and environmental factors. And in promoting recovery, what are you doing? You're identifying and responding early, supporting mental health problems and its recovery. Next slide, please. Platforms for actions. 5 actions to be taken here, but they're going to continue on the next slide. Number 1, healthy workplace policy. So we always start with policy, really, because if not, then what is the reference point? Where is point 0? Example, you can end the stigma reduction, social inclusion, occupational safety and health policies, and HR policies. So you can start from that standpoint. The second is what you can do. You can create supportive environments. Example, make programs that fostering anti-bullying approaches, strengthening families and family ties, healthy work initiatives. 3, strengthening workplace and communities to take action. How? Through peer support, through worker-led initiatives. Let them take the lead sometimes. It's okay, they get empowered and they know that mental health, the Paul has just showed us how important it is for everyone, really. And it is holistic. It's the individual's duty to take care of him or herself in addition to the workplace. Because 8, 8, and 8. Okay. Next slide, please. Yes. Okay. Developing personal skills. Like what? Like life skills training, mental illness literacy, at least to have your employees know about it, understand that it's okay. And this is something more or less we're all prone to seeing a therapist at one point in our lives. Parenting skills could be something that you want to think of, in addition to personal financial management. And the last one is occupational safety and health services to promote to a promotion and prevention approach. So you reorient your occupational safety and health services. Example, inclusion of mental health and well-being, to work towards that inclusion. And the UAE is known to work towards that. All right. Taking a look at the right side poster, you will examine the factors that affect mental health and well-being in the office, from temperature to design to light to social interaction, you name it. If we take a look at the report recently published a couple of weeks ago, that is, by both Emirates Green Building Council and Saint-Gobain from France, they addressed a significant factor that plays an important role in schools, which is a place for learning, which is quite similar to a workplace where we want to grow and think and learn as well. So one finding of the report tells us that the outdoor air quality is 90% better than the indoor air quality in the UAE school buildings. And I wonder, what's it like at your workplace? Whether it's a green building or not, what is the percentage there? And how is that parameter alone affecting your employees' performance, keeping everything else standardized, let's say? Next slide, please. Bottom line, after COVID, less jobs and social services. This is across the world. Social issues have been arising, child abuse, domestic abuse, alcoholism. This all has been on the rise. But individuals are still being blamed rather than seeing this whole thing as a systematic problem. Why? It's a rhetorical question. Why? So we need to make a change at the level of decision makers and upper management. Next slide, please. To make that change, we need to understand the factors that support the spread of positive management practices. Top left, beginning of the semicircle, having appropriate networks to facilitate organizational learning. You're obviously in the right network of Dubai Chamber Sustainability, and we are here to learn from one another. So this ticks the first box. Great. Number two, catalysts of change. We have seen those members of our families who know how to accept and promote change, but at the workplace, it has to be at the upper management level and leadership too, or else it won't be effective much, right? Number three, are you able to delegate? In the area of mental health programs, would you trust your HR executive to embrace a mental health program for your employees? Number four, creating and fostering a sense of belongingness, a sense of ownership. Do you allow your team to take risks by treating the business like it's their own in order to save it? And lastly, do you allow room for trust to grow across your teams? Communication style, what's it like? Is it two-way? Is it one-way? Especially after the numbers we have seen. Next slide, please. Applied to mental health in the workplace issue. Here are the factors for success from PwC report. First, we need to have commitment from senior leaders towards mental health, and not just a word, a nice, good word that flows around in the atmosphere from time to time. And second, we need to allow the employees to feel heard through their participation, active participation. And three, to develop and implement mental health policies. And four, to allocate resources for success through mental health and wellness. And we need to have ongoing effort for sustainable approach. Not enough to have one-time event for, once a year event for wellness. That's not enough. It's good. It's better than not having anything, but we need sustainability. Okay, so here, plan and evaluate at the end. This is again part of the senior leader's job to evaluate what's going on, to monitor whether these mental health programs have been actionable, have been effective. Analyze your own data, get a control group with no program, nothing for mental health, and an experiential group. I know I sound pretty much the researcher that I am, but try to understand the data, what is happening with mental health programs and without it, okay? With allocating budget and implemented programs for mental health and without doing that, and see what works best, really. That's my invitation to everyone. Next slide, please. All right, 2 main insights on happiness and well-being. From Yale University, what do we know about the brain? We know about the brain from Dr. Santos. She's an expert and professor on happiness and well-being, that the brain tells us to miswant things. Like you think sometimes, okay, if I have this property, if I have this house, if I have and collect and have more and more, then I'll be happy. But in fact, it's not relevant. Sometimes the opposite happens, and we will explore what makes people happy in the workplace, in their personal lives. Another study that shows really by Harvard what happiness is, shows 3 categories of people. The first, they report, yes, we want things and property and real estate and all of that, and this makes me happy because these are contributing to the pleasures of my life. And second, social connections, social emotional connections. This is the second category. They tell you, this is what I really want. Okay, pleasures are good, but they're not enough. I want something else. And the third, they're driven by a purpose. They tell you we're happy when we have a purpose for our life, a calling. So I'll end on a note from this exceptional 75-year extended kind of study from Harvard. So they passed it on, the experts and researchers passed it on from one generation of Harvard experts to another to reveal the power of what makes us happy, really, what makes us, what contributes to our well-being. And the results and the findings show that it's the power of our close connections. Who are you really close to, and the quality of your close relationships This is the major and significant factor contributing to your happiness. So how do such findings affect HR specialists and decision makers in companies? Next slide, please. Thank you for listening and for watching. I'm happy to take your questions in the Q&A segment at the end of the session.
Thank you so much, Dr. Jaina. Really a very informative presentation, very insightful, and at the same time, very inspiring, I'm sure, for the company's members, especially the HR leaders. And to be honest, I'm very shocked to hear that it's the India and UAE that are most worst affected in terms of the mental health, and that 1 person out of 5 have got the problem of mental health because of the COVID-19 situation. So that actually shows that it's very alarming at this stage. And I'm glad that you highlighted that, it's the nature, which is a nurture, it's the environment, and at the same time, the sense of belongingness, the power of connections is very, very important, which needs to be, holded and preserved at such stages. And it's very nice to also know what are the various action points that a company can take. And you said it very rightly that, it cannot be ad hoc activities, though something is better than nothing. But yes, there has to be a commitment from the leaders. So thank you very much, Dr. Jaina.
Providing disclosure, and I'm happy to contribute. Thank you so much.
Thank you so much. And now I would like to invite our next speaker, Ms. Lakshmi Montgomery. She is Employee Relations Manager at Delsco with a very rich practical hands-on experience. So over to you, Lakshmi.
Thank you, Sangeeta. Good morning to you all, and happy Ramadan to you. I thank Dubai Chambers for giving us this opportunity. Can we go to the slide, Sangeeta, now? This is what we all ask. Are you safe? Are you fine? This is exactly how we greet people. And what do we expect from others? And what are you expected to say? Yes, I'm fine. Whereas inside you might be broken, fragile, you might feel defeated, you're lonely, you're rejected. But what is positive psychology? Positive psychology is all about saying, I am not okay when you're not okay. It's okay to say I'm not okay. And when you're not okay, how you pick up and you take things, the buoyancy, what you bring in your life, and get on with your life. As Dr. Kamal said, we are here for business. So when it is just not about thriving, it's about prospering. That is your resilience. So this is what we are going to explore. And as Delsco, which is a 12,000 plus blue collar manpower organization, what Delsco, the leadership team, the visionary leadership team, and the HR team have worked, and it has given results. So this is what we are going to explore in the coming slides. Can I have the next slide, please? So when you say health, health is a multi-dimensional concept. It's your physical, mental, social, your spiritual, your psychological well-being. And yes, it is not merely the absence of diseases. Now, when we talk about this, then what is ill health? Ill health is when any one element or one component, there is an abnormality there. So if it is just not one instance, but it is over a period of time or what is prolonged, it can affect your emotional, the way you are in your social life. It can give you a lot of physical pain, like recurrent headaches, recurrent backaches, but actually it can be a psychosomatic. It can bring in a lot of endocrinal problems, palpitating heart. So all this is your ill health. Can I have the next slide, please? So what did we observe? So during the past year, of course, the pandemic, and even before that, We have observed, because they are blue-collar employees who come out from the comfort of their home, they come here to a country where they are disconnected with their family. We find a lot of abnormal or mental health issues. It can be like withdrawn, excessive, tiredness, or they are indecisive, or they are feeling fearful, or they are hallucinating, delirium. Most of it, it can be, of course, yes, detached from your social group, the homogeneous group, but it can also be your poor nutrition, your hydration, or also the amount of rest that you take. But we have also seen extreme cases of bipolar disorder where someone is happy on one extent, on the other day he's sad, he's remorseful. So this kind of abnormal behaviors were observed. Now it is just not seeing this abnormal behavior with the help of the clinic, that we have a full-fledged clinics with Dulsco. But what did Dulsco do? What did we do? What were the proactive steps that we took to manage and to prevent such cases? Can I have the next slide, please, Sangeeta? Now, if you take positive psychology, emotional, psychological, and social well-being, this is what is the sum total of a positive psychology. That means you feel good. When a person feels good, he feels happy, or it is otherwise called as eudaimonia. You function well, you are able to contribute, you are able to take care of yourself, you are contributing to the business, and you are a good team player, and you are connected to others. This is exactly what we try to inculcate with the workers who are coming on board from the various countries to UAE. Can I have the next slide? So what did we do? So the first thing that we addressed was adopting the rapid model, a reflective listening. R is your reflective listening. They listen to the employees. You are active listener, and you also try to absorb what they're saying, and then you put it back to them, the same question, to see that there is no ambiguity in what the employee is telling to you. We help them assess what situation they are in, prioritize which has to be addressed first. We give them interventions. Most of the interventions during the discussion is given by the employee themselves, and the disposition is how the employee has to respond. Various life skill empowerment is one of the proactive measures that we give, so that employee is able to take care of himself, take care of his family back home, and also the physical. Physical well-being cannot be detached from mental well-being. Sound mind lives in a sound body. We have always heard about it. So we do a lot of risk assessments here, physical well-being, medical camps, creating awareness, training, and also at the same time coaching employees to take care of themselves and to keep connected. Can I have the next slide, please? Employee empowerment is one such aspect where an employee feels, and this is where he says, I am not okay. He's able to express themselves. So this is done through open houses. We have grievance addresses. We hear to employees who want to leave and go. And then we put proactive measures. And at the same time, we also have other initiatives like continuous risk assessment, educating them, training classes, upskilling them. And in this way, they are also becoming financially sound and develop a lot of self-confidence. Can I have the next slide? So this was the second step. So we have gathered what are the abnormal conditions, what was there. So here in the Digital Brain and Mind Center, we have tried to, we gathered it together. Was it because, are they suffering from anxiety? Are they suffering from depression, stress? Are they suffering from panic disorder? So we brought them under this Digital Brain and Mind Center. The second is the welfare officers. Now we have a very sound welfare officers team. They are from a community development background. They are all masters in social work. They are also with medical and psychiatry. During the last year, they picked up about 27 courses to enrich themselves in mental health. And we started something called as preventive neurodegeneration, where they're able to function, thrive, and prosper. When they do it at their level, they're doing it at the organization level. nutritional psychiatry, support group, identifying sensitizers. When one of them is able to support them or talk to them, it's easily understood and absorbed by the other. We introduced the concept of music, dance, colors. We brought the concept of mandalas. A employee or a worker who's highly stressed, you give color to them. They are transformed to a different world. And then you can also find out what mental state he or she is. We introduce a concept stretching, yoga, counseling to workers who are quarantined, who are isolated. It was last year they didn't know what COVID was all about. So speaking to them over the phone, which is also called as remote first aid, psychological first aid was given to them to make them feel that they are cared for. An employee who feels he's cared for is positive and is more productive to the organization. Can I have the next slide, please? So let us see what we did. The second step, what we did was train the first line of supervisors, accommodation administrators. We don't call them as camp bosses. We call them as accommodation administrators, the line managers, the timekeepers. Now they should also understand what is going on with them, and we should also able to say what is going on with their team that they are working with. So here I have just picked up two of the self-assessment kit that we prepared for them to understand and also to what is going on with their team. For example, let us take anxiety. Anxiety is something where all of us went through, we all go through it, but here this is just not one time off, but it is over a period of time. There's dryness of mouth, tremors, you're running to the washroom often, there's palpitation, there's flushing, you feel very hot. Now, yes, it is all dependent on one's personality. Maybe it is your personality, but it can be alcohol, substance abuse, or it can be withdrawal. You're afraid of losing your job. Again, poor nutrition is also a factor where there is a deficiency of certain vitamin, or it is an imbalance causes anxiety. Can I have the next slide, please? So what was a self-assessment kit here? These are the series of questions what is given. It is not directly asked to the employee, but over the discussion, we gather these information. So whether he's panicky, feelings dizzy, spells, how often it is. So basically what we are trying to try to compartmentalize is whether it is happening rarely or it is sometimes, whether it is good part or if it is mostly. Now, when you go to the next slide, Sangeeta, please. Now, here is what we have done with the scores. 20 to 44, if you have the score, yes, you are normal. But then if you are normal, you shouldn't let it go. You should continue with the active lifestyle. You should participate in CSR. There's an art of giving. Art of giving gives a lot of mental health or mental support, mental peace to oneself. Now, this art of giving is just not money. It can be your time with someone. And then we have the score of mild. Of course, you require counseling therapy and cognitive. Here is where we brought in cognitive behavior therapies. We picked up employees showing open cases of abnormal behavior. We prepared case studies. We have about 99 such case studies. We didn't have to let go of everyone who showed abnormal behavior. It is just not reducing, but it is also we help to manage the distress what went through. And today, most of them are back. They are working with us and highly productive. So only when cases are where they need an intervention, a pharmacological intervention like medications, and you need a psychiatrist, only those employees were let go of. Otherwise, they are all still working with us. Can I have the next slide? This is something what most of us can relate to, a sleeping disorder. And I'm sure all of you have gone through this. It can be, let us not confuse with sleep apnea, where it is basically because of obesity. Again, it is a psychological issues with poor medical disorder. You can have any distressing, you're away from your family, something is going wrong with the family back. I'm talking in terms of with respect to a blue-collar employee who's unable to rush back home. So all these have left to a sleeping disorder. Now we are not talking again of one-off time, but it is over a period of time. Can I have the next slide? So again, these are some of the questions that we have asked. Is there any difficulty in understanding your sleep pattern? So this is if it is a staff, or if he's or the staff level, so he's able to take on his own. But if it is a worker, this is how we try to gather information when we are discussing with the employee. Can I have the next slide? So this is how we have again planned or given the interventions up to 44 your normal, but again continue with your active lifestyle. See that you are not watching something horror, watching something which is distressing to you before going to sleep, having a sleep pattern. And we are trying to educate even the staff about the different sleep recommendations for you and your family. We are living in a family where we have our older parents living with us, we have children. So every age group requires a different sleeping time, sleeping hours. It is not, sometimes I always wonder when you go at 12 o'clock or 10 o'clock or 11 o'clock in the mall, there are families with children, everybody there. So next time when you're coming back to work, either your kid is awake or keeps you awake and you are not able to come to work. So developing a sleeping pattern will always give you that restful and helps take care of your mental health. Can I have the next slide? We have talked about what mental health is and what positive psychology is and how we adults have tried to build. But then what is resilience? Once you build a positive psychology, you will build resilience. Resilience is something where there is an unforeseen circumstance, you face it, but you also have the buoyancy to come back and bounce back and then continue to perform at your best. Can I have the next slide? Everyone is not born resilient. Like a maple tree, there's a change in climate, but you still survive, stand, give out different colors, and you survive at the end of the day. But then, can resilience be learned? Can I have the next slide? These are the different ways that you can learn resilience skills. You have to learn to take no for an answer. Like how you say, I am fine, I am not okay. In the same way, you can build a resilience threshold. Learning a new skill, this is a very humbling experience which will help you to build again your resilience. Keep your dialogue. Like for example, you cannot say, okay, like how we have your strengths, we have your weaknesses. In the same way, we can always replace words like failure to obstacle, a downfall to a setback. So I can do it, but I need some time to do it. So looking at your own perspective, you can always take an uncomfortable situation, try on it, take the help of others, ask for help is how you can build your resilience and manage your energy levels. The challenge or the job which requires more time of yours or more energy, try to pick up your time, understand your body. When is your higher energy levels? Maybe you can pick up that time to address one of the most challenging job that is given to you. And always practice to speak positive. And we have always seen this in counseling. Once you start repeating what adverse situation you have gone through, your body starts getting numb. Your body starts, your parasympathetic, that is your rest and digest mechanisms, takes precedence over it. And hence your heart rate, you're able to control all your negative emotions. Can I have the next slide? So this is one that we created in the year 2020 to bring in harmony with yourself. So how do you learn to forgive? You cannot keep things within yourself. Learn to go for a music, dance, do some new activities. So this is like a poster which is put on everyone's table. So you go through it and you can adopt at least one a day and bring in a positive attitude towards life. Can I have the next slide? So we always feel, okay, this is what we have done. We are data driven. Has these proactive measures given us better results? Yes. There is a reduction in sick leave. An employee who keeps going to the clinic with recurrent backache, you have done MRI, you have put on medications, you have done X-ray. But when you sit to consult, these are psychosomatic pains. We could see that they have improved over a period of time. Accidents reduced, complaints reduced, there were disciplinary actions which reduced, fines reduced, attrition reduced. So as Dr. Kamal said, we are here for business, and this is what bringing in positivity and positive mental health in workers has brought in. Can I have the next slide? So once before we go, we all know who Michael Jordan is. We all worship him. All the basketball fans worship him as a legend. So this is what he said: I've missed more than 9,000 shots in my career. I've lost almost 300 games 26 times. I've been trusted to take the game-winning shot, and I have missed. I've failed over and over and over again in my life, and that's why I succeeded. So this is something wonderful for us to take home to learn on positive psychology. Going into an uncomfortable situation, building your resilience. Can I have the next slide? So thank you all. Like how I've used the 7 scorecards. Every day is not the same. Learn to coach yourself, keep yourself well hydrated, keep yourself well nourished, have a lot of rest, and be safe. Thank you so much.
Thank you so much, Lakshmi, for very, very inspiring presentation. Actually, you have taken us through the strategy, the approach that your organization has adopted, the various tools, mechanisms, and how it has been adopted at a broad company level. So thank you very much for sharing all these useful insights. And thank you for highlighting that, how it has to be addressed collectively, which we, saw that many people have during the survey answered that it is a collective responsibility. So I'm glad to hear how your organization has actually taken that collective responsibility and have devised various coping mechanisms. And at the same time, thank you for highlighting the self-coping mechanisms, which are very, very important, because at the end of the day, it's you who has to take care of your health, whether it's physical or mental. Thank you for highlighting some of the top tips at the same time. So thank you so much, Lakshmi, for very, very useful presentation.
Thank you, Sangeeta. Thank you.
And now I would like to invite our next speaker, Dr. Meghed Iskandar. He is Business Executive Officer, Health Science with Nestle, and he has over 25 years of experience as a leadership role in Nestle. So over to you, Dr. Meghed.
Thank you. Thank you very much, Dr. Sangeeta. And I'd like to thank Dubai Chamber, Dubai Sustainability Network, and Center for Responsible Business for really organizing this webinar. It's a very important cause, and it's very close to my heart, and that's why I'm happy to be part of this event and the future ones. Thanks also to Dr. Kamel and all the team in Dubai Chamber. I'd like also to thank our colleague Yasmin, who introduced me to this event. She is our head of sustainability. Sustainability is an important topic at Nestle. And I'd like to thank all of the participants, because to be honest with you, today, when you are here dedicating this time for this event, this means a lot. This means that you really care about your people. And that's why I'm happy to be with you. Just a quick introduction about myself. Yes, I'm originally a medical doctor by education and practice. I found my way into Nestle 25 years ago because of my passion to people, and because also at Nestle we serve a great purpose. We enhance quality of life and contribute to a healthier future. And this is, again, a very important part of my cause. With my passion for people, I started having postgraduate studies in psychology. So I started with business psychology and then positive psychology, and now in a field called lifestyle medicine. So I would like today, to be honest with you, now I have to employ a lot of presentation skills, especially after presenting after two lovely presentations that we heard, and also to make sure that I manage the time, as I know that we are a little bit behind schedule. So if you can go to the next slide, please. And here I would like to highlight the two areas that I would like to talk about today. Maybe the first part I will not give much time because it was already addressed by our other two speakers, which is the mental health, but mainly about the collective well-being. And I will show you now how I'm coming from, where I'm coming from. You are, as managers or supervisors or leaders in your organization, HR managers, I'm sure you care for your people. And that's why you are here. So I would like to speak to your mind and to your heart. Think about your team members. Think about, maybe remember a story about someone of your team who has already struggled with some difficulties. And what I would like to think about in the coming period is how can we help them, but also help the rest of the organization to be better. So if you go to the next slide, please, I would like to maybe quickly run this. Maybe we spoke about it. What I would like to say that mental health conditions are common, definitely, and are costly. So for us as an organization, we need to be aware that it is common. It is not something that is far away from us, and it can cost us a lot. In the next slide, you would see that why we are not talking a lot about it, because, and especially in some cultures, there is a stigma. There is stigma behind mental health. And some people even, they say, you have noticed I said mental health conditions. There are a lot of words about mental health disease or issues or troubles, but I'd like to really think about it that mental health is something that can impact any one of us. And the stigma is mainly because some of the employees think that when I talk about it, this makes me look weak or not professional enough, and this might impact my career. Also for employers, they might think that this might show that my organization has a problem. And for managers, they might be embarrassed or not really aware how can they manage this or how can they deal with their team members whenever they have a condition. Next slide. Definitely, we know that there are triggers in the workplace that can initiate this. And our role here as managers or leaders is really to make sure that we find ways to avoid this from happening. So long working hours without enough breaks, unfeasible deadline. Remember, this is something that can cause stress in the workplace. Of course, ambiguity and not clearly understanding my role as a person, as an employee, is something that is very important. And for sure, the relationship within the company can be sometimes impacting negatively. Let's remember, when we talk about our teams, we're talking about a whole human being. So they are at workplace, might be really challenged with these workplace conditions, but also remember that they are also people who have families and they might have illness or disability at home or caring for another family member. They have a relationship issue or social isolation, which is mainly happening now more and more in our environment, especially after COVID pandemic has hit us. So in the next slide, you will see that as managers, we need really to be mindful. We need to keep our eyes open. I'm sure we should not expect that all of us as managers to be experts in psychology and be able to manage and treat mental health conditions. What we can do is that we keep an open eye, because if we can really detect this early, we can help our people better. So have a look at behavior of your team members, whether, for example, they have a change in their look, they have change in behavior recently. What's the level of their motivation? How is the quality of their work and their work pattern, if there is any change? They have been asking for sick leaves for some time recently. All of these are things that can help us really to see and detect early. If we detect early, what we can do, if you can go to the next slide, we can really make a difference. We can really help our people. because we are, as managers, it is our responsibility to care for our team members. Creating a compassionate environment. The word compassionate sometimes maybe is not used a lot at workplace, and one of my endeavors is really to bring back humanity to workplace, and compassion is an important word that I would like to really to use it more. So be compassionate about your team. Know them well. If you really know your team, if I know my team well, I will be able really to detect any things at the beginning. When I ask them, and instead of just asking about how are you doing, and specifically at work, I would ask them, how are you feeling today? And asking people about their feeling is one of the most interesting ways of getting them to come back to you and speak and tell you if they are really having some sort of a challenge. We can help our organization at the workplace to be open about stress and about mental health and about mental well-being. It is important, and I think now all of you being part of this webinar, you can play an important role in your company. I'm very happy that a lot of our team members also at Nestle Middle East and North Africa here are present also with us in the webinar, because it is something that we are also caring a lot about in Nestle. We care about people's health, we care about mental health, and now we're moving into the more collective well-being. And remember, there are some simple adjustments that we can do to help our team members, like for example, working schedule, flexible hours, having enough breaks, sometimes even changing the seat of one employee to become near the light, near the daylight, can help him or her to really feel better and do better. In the next slide, I would like you also to think about yourself. It is not only us as managers, but also as people, we might also be stressed. So some of the coping mechanisms that I'm sure you have heard also from the other presenters is that we care for ourselves, we care for our body, we care for by doing exercise, eating well, but also taking responsibility of the situation. And I'm saying here that if we have an issue, we should be also responsible about it. It is not always the best thing is that I would say, it is my company, it is my boss. No, I have a role to play as a person in this situation, and I have to speak up and I have to talk. Don't hide my emotion. On the contrary, I would like to ask for help whenever it's needed. Of course, I should not be harsh on myself and put for myself realistic goals, because all of these are part of the coping mechanism that we can use. In the next slide, I would like to move to actually my interest is really how can we bring collective well-being. And here, I would like to go to a higher level a bit. And the science of positive psychology, which inspired me to do this master's degree on, is really about optimal human functioning. So here I'm not talking about people who are suffering from mental health condition. I'm talking about every one of us. I'm talking about the normal population. And how can we bring them? If you see the diagram on the right side, instead of counseling therapy that helps people really to overcome disease conditions like anxiety or depression, positive psychology takes us to a higher potential, to achieve our ultimate goal, to become really flourishing. And in the next slide, you will see that the World Health Organization has defined health, but not being free of disease. And well-being here is much beyond the mental health. So it is a collective state. It's physical, mental, and social. And this is what I would like us to focus on and move forward. How can we help our organization to move? In the next slide, you will see that as it was mentioned several times, we are in business here. And there is a real business case here. And even here, the World Health Organization has defined this, that healthy workplace can support business success. In the next slide, you will see that a lot of research was done in order to help people really understand how can we make our workforce, our workplace more productive. And the study done by Oxford University has found out that people who are happier are more productive. And I think this is what we'd like to do. Imagine this, a situation where we help our people to be happy, ourselves are happy, and at the end, we are more productive. And this is what I would like to focus on, is that by helping our employees, by helping ourselves to be happier at workplace, we would become more productive. In the next slide, you will see that actually the spectrum of people, and this is data from a study done in the US called the midlife study, it shows that if we look at people, we'll find that yes, some people are suffering from mental disorders, some people are languishing, which are going into this. 57% of us are called moderately mentally healthy, and 17% only are fitting to the criteria of what we call flourishing. What's flourishing? Flourishing is really being able to achieve and thrive, be happy, and have a well-being. And this is something that we'd like to think about. Imagine if we can bring more and more people instead of only 17%. Imagine if you have only 17% of your organization are flourishing and able to really achieve their ultimate potential. And you are getting these results that you are getting now from your business. If you want to really grow, do you think getting more people into this flourishing will help? Definitely. In the next slide, I would like to close with this PERMA model, which was developed by Professor Martin Seligman, who is the founder of positive psychology, and he put this, that these are means that can help us to bring people to flourish. And flourishing people are, in my opinion, are the making of a thriving organization. In the next slide, I will explain, just for sake of time. Would like to have questions, but I know that we would like to leave some time for the other questions. But in the next slide, you will see that PERMA is presenting 5 important elements, and if we can really dedicate some more time in the future, we can talk about them more. Positive emotion, definitely. Engagement at work is a very important topic. Imagine we need all of our employees to be engaged. If you go to the previous slide just a second, Dr. Sanjita, I will finish. Engagement is an important topic. R is relationship, M is meaning, and E is achievement. So I know you were not able to go to the previous slide probably, but just to show the people that the meaning is companies who are able to find meaning in their organization, find meaning to do something, is really very important for them to achieve. And then this is the last slide about the local endeavor by United Arab Emirates. We are actually lucky and should be appreciative of the effort done by United Arab Emirates government, because they have also identified happiness and well-being in the workplace as a very important topic. And that's why I'm happy that all of us here together can make a difference moving forward. I'm happy to take questions. I don't know, Dr. Sanjita, if you have more time for questions. I did my best to overcome the time, but happy to connect with any one of you. Please, you can get my my email address and get in touch whenever you want. Thank you.
Thank you very much, Dr. Magid, for very informative presentation and very encouraging. Especially, I like the fact that you highlighted that, yes, it's a collective responsibility, but at the same time, I think managers, supervisors, HODs, they hold a bigger responsibility in terms of identifying, you know, the various signs and symptoms, if at all their team members are facing, and how to deal with those. And you said it very right that, you know, asking a simple question, genuinely, how are you feeling, makes a big difference, and it goes a long way. So thank you very much for highlighting. And also, I like the fact you talked about positive psychology. And yes, it does affect a person. And I think overall mental health is directly related to happiness, well-being, and definitely then the efficiency and productivity at workplace. And that's what also makes a big business case. And thank you for highlighting that. Yes, it does makes a big business case. It reduces the overall cost and improves efficiency and productivity at workplace. And that's where it is very important for companies, for businesses, for HR leaders, managers to identify this problem and try to resolve it. Also, it's very alarming to know that only 17% of the people are flourishing. I mean, it's really shocking actually to know that way. But yes, I'm
possibly
sure
we can make a difference. Let's add
yes.
more and more people.
Yes, so I'm glad that we are running this webinar today. So I'm sure it will make a big difference. And the 17% definitely will become 70% over a period of time soon, I think a year. So thank you very much. And now we move to our next session, which is Q&A session. So I would like to invite all the speakers to be in the panel for taking the Q&A. And please feel free to answer any question that you feel you can address well. So the first question is from Ahmed Hussain, and he has asked that how to deal with toxic, selfish bosses, especially when they are very good in their work. So it may sound little this, but yes, sometimes we do face these kind of situations, and I'm sure some people might be facing. So how would you like to address? I think Dr. Megat will be in a good position to answer it.
Yeah, sure. I'm happy to take this. Yeah, challenging bosses is definitely a challenging situation, and I think a couple of things here that I can say. But of course, it differs from one case to another, so I will have some general answers to this, and later on we can, if there is a specific point, we can address. In general, in order for a relationship to be successful, we need two people. So the second person also has 100% responsibility. So the relationship between two people, the split of responsibility is not 50% and 50%. It's 100% and 100%. So I also have a responsibility to make sure that this relationship is successful. And in business relationship, as an employee and a manager, I also have a responsibility toward this. So while I might help someone else to change, I will not be able really to do this. And maybe it would be difficult to change my boss. What I can do is I can focus on what I can make a difference with. So first, understanding what are the challenges that he is specifically looking for. Having a clear communication and open communication, addressing these issues between myself and manager is very important. The third thing is thinking about how can I change? What are the things that I would need to do in order to change, in order to improve this relationship? And of course, if this all works, this is great, because I expect that when we have this open and transparent communication, we can change. Some people, they might have a misunderstanding or misconception. When I clarify this, it gets our relationship better. If this worked, great. If it did not work, as this is the case in many organizations, we have policies, we have procedures, we have people to support, we have our HR colleagues to support. And I think opening this to a third party and having another people to help us and to get into the conversation might and also resolve the situation. These are the four things that I would recommend on tip, just to answer your question.
Thank you very much, Dr. Megat. I think it was a very, very mature response that you gave. I think, we have to first take a responsibility ourselves and try to, see that how and what are the various things that we can improve in order to improve that relationship. So thank you very much, Dr. Megat. And the second question is from Ravi Prava. He's asking that sometimes if, the staff has met with an accident, then there is an investigation that goes on. And sometimes the investigation can be quite stressful for definitely various reasons. So how can an employee or a staff can deal with such situation and can also at the same time, comply with the company procedures? So Lakshmi, would you like to take this question?
Yeah, this is to Ravi. I think it's a very good question, and when I'm sure there is a risk assessment done for any accident. There's an incident report which is initially created in the first 24 hours after the accident. We also have to understand the human factor. And as we discussed during this session, that your physical health and mental health goes hand in hand. You will have to look into the risk factors as to, is it because of a certain physical condition or a metabolic condition that a person was at a low energy level that caused an accident, which is basically during the investigation. The second is get the things like your refractive error, eye checkup, your audiometry, is there color blindness. So these are all human factors which you have to rule out. The second is, yes, what is there, we do a psychometry. So you cannot be spending money on psychometry for each person, but when you're sitting and counseling, like what I said, the rapid model, when you listen to them and you answer and you question them same back, whatever they are speaking to you, rephrasing it, you're bound to get the right answers, and you will make the person feel. Immediately after an accident, I advise, don't question the employee because they are so frightened, they're agitated. Put them at rest. Use some very soothing words, and then you can start with your investigations. I hope I've answered your question.
Yes, thank you very much, Lakshmi. Thank you so much for dealing with this question so well, and also advising at the same time that yes, it's for both. Staff will have to go through, the investigation, because it's really important to find out the real reasons that led to that accident. And also it's equally important for an employer or supervisor, manager to not immediately start posing questions, but take it a little, warmly with time. So thank you very much, Lakshmi. And we have one more question. And this question is that, if a person is feeling stressed because of the manager at workplace, then is it that this person should leave the work, or how to deal with it? So is leaving the work the only option, or there are other ways and mechanisms that one can deal with? Yes, Dr. Jaina.
Thank you, Dr. Sharma. It's a very good question. I think we've all faced that at one point, more or less. It's not uncommon, something that we face. Sometimes we do have toxic relationships with bosses or with colleagues. However, the question, should I leave? It really depends. It depends if you can afford that, number one, to be realistic, if you can afford that. And number two, did it really reach a sense where you can no longer take it on all levels? This is a rhetorical and self-reflective kind of question. Can you not handle it anymore at all? Are you not able to face that person at work or to see them? Is there a dead end, no solution whatsoever? If it's getting to you and getting on your nerves and you feel like you can't breathe, you might have panic attacks or something serious, then only I would say I would start considering it. If I can afford it, but really just to sit down and leave work without having an escape route, or at least an alternative workplace, I think it becomes a little bit of what we call a coping skill for an escapist, for people who run away every time. So the skills we need at work and in our personal lives are certainly mainly assertiveness. We have to feel confident first so that we look confident, and to face any of such struggles. So I would say it depends on whether or not you can afford that, and if it's really something unbearable pertaining to your mental health, physical health, and maybe that have to do with insults or something like that, then you wouldn't really accept it.
Thank you so much, Dr. Jaina, for giving a very wise advice. Really, yes, I think it's very important to see the affordability because if you're not able to afford, then you might lead into several other kind of implications and situations which might be even more unfavorable than what you are in. And another is, yes, you have to assess yourself. You have to do a little bit of introspection that, whether you can bear it anymore, or you just can't live with it. So thank you so much, Dr. Jaina.
Thanks.
And now our next question is that some people with
Sorry,
determination,
Sangeeta,
or
sorry,
people with disabilities.
do you mind if I add one small point just to do the
Yes,
last
Dr.
question?
Megan,
Please
please.
go ahead.
Thank you very much for the answer. It's great, and I fully support it. Just two other elements just to add. One thing is, first, before taking a decision to leave, ask for help. And I think many of us said this today, that ask for help. I mean, go talk to other people who can help you. This is one thing. Another thing, leaving the job and moving forward, I would like always to think that I would leave this job and I go to another job because this is something that helps my purpose, my meaning, something that I would like to do in my life. So thinking to leave a job and go to another job is something that we can do. Let's take the positive element of it and move to the one that really makes a difference in our life and add value, rather than leaving because I cannot cope with a person.
Yeah.
See the difference? Thank you.
Thank you so much, Dr. Megan. I can really say this is coming out of your experience. Thank you very much. Thank you for adding this point. So next question is coming from Priscilla Fernandez, and she is saying that, there are some people with determination, people of disabilities, who get severely affected at the workplace, and they have got severely affected at workplace during COVID. So how do they need to go for a professional help? Because yes, one, definitely they have got isolated from rest of their colleagues. So how can they approach a professional help in this case? Dr. Jaina, would you like to address this?
Sure. So to approach mental health in terms of the steps, you mean?
Yes. So there are some people who have, who are, people with disabilities. And then they are the ones who have also got affected at workplace because of the COVID situation mentally. So how do they approach for a professional help? So do they?
I wouldn't say there's a specific approach, specifically here in the UAE, Ashab al-Himam, or people of determination. They're welcomed in many workplaces and they're being supported. It's really that you have to stand up for yourself and be realistic without having any denial. I would ask myself, Jana, do you need professional help? If I've done, as Dr. Majid implied, everything within my control, and I reached out to a professional by, of course, checking out their reputation, word of mouth. These are the steps I would check. I would do my homework first to go to the right person for me. And then if I reach out and I start the sessions and I haven't seen any progress in terms of how I'm reacting to my workplace and how I'm dealing with confrontational situations, then probably I would say, okay, yes, I've done everything within my control and I can't take it no longer. But the steps are no different than any other person, whether you're physically challenged or not, because what matters here is your mental state and your mental health. Are you really taking care of it, no matter how physically challenged you are or not?
Thank you very much, Dr. Jana. I think we'll take 2 more questions because we are running short of time. So one is this question from Abhinan CK. He is asking that when we are working long hours, how do we maintain a healthy mental state? So Lakshmi, would you like to address this?
Yeah, I would suggest again, keep yourself well nourished, well hydrated, have a good rest. Try to take break in between. There are a lot of activities what you can do at your desk space, like your breathing techniques, these, and you're stretching at your desk, this will really help you to, and prioritize your work. As try to assess, prioritize which needs your attention more. If there is something challenging, keep it for the time where your energy levels are high. Suppose you feel that this is highly challenging work and you feel your energy levels are at its peak in the morning, first address that issue. But see that you're having good rest and well nourished. I will insist on that. And keep yourself well hydrated, because if you're keeping yourself well hydrated, you're alert, and the fatigue that sets in is also slower.
Thank you so much,
I hope
Lakshmi.
I answered that question.
Yes, yes. And Dr. Megat, though, have already talked about talking about mental health without stigma. This is a question saying that from Shravan Kumar, saying that how employees can speak freely about mental health without prejudices and consequences at workplace. So, Dr. Megat, would you like to take this question?
Yes, sure. As I said, I mean, it is our responsibility. I mean, we should not be shy. I mean, now we have heard today from all the speakers that if I felt stressed or anxious or somehow depressed, this does not mean that I am not normal. No, this is normal. I mean, this is a human being. It's a human nature. Every one of us, I mean, we said 25% at least will suffer from this every year. So one out of four of us will have this at a certain point of time. So it is normal. This is the first thing we need to start with. It is normal that I feel pressured sometime. The good thing is now we have environment that can help. And this is, again, what's happening today. By all of us here, the 150 who have attended and 100 remaining in the call now, we can make a difference. We can instill, we can talk about it more about in our culture, in our companies, in our organizations, and make sure that people are really accepting this. This is one thing. Ourselves as people, we can do this. As managers in our organization, we can do this. We create more environment. And as managers, we help our team members. So we have three parts to play here. As a person, for myself, as a manager or supervisor to my team members, and as a member of an organization, how can I do more and more in my organization? If we can do this, we will definitely have more and more attention to this topic. And remember, as I said, it is common, it is costly, it is my role to take action. So if I'm the one who is affected, let me first of all think, how can I help myself? If I can do things, great. If I need help, let me ask for help. And this is open. It's imagine any one of us, if I suffer from a headache or a back pain, wouldn't I go to a doctor and ask him, doctor, how can you help me with alleviating this pain? It's the same thing. We go to the people who can really help us, and I'm sure we can find this this.
Thank you so much, Dr. Megat.
May I add one thing to what Dr. Majid said, just to end it with a recommendation of a book? A social media success story happened with an American psychologist, and her name is Dr. Nicole LaPera. And she's on Instagram known as the Holistic Psychologist. And a couple of weeks ago, she published her first book, and it's called How to Do the Work. And this is what associates with what Dr. Majid was saying, how to do the work. This book, I find it personally valuable and fascinating because it explains to anyone who has no idea of how to do the work, okay, through a psychologist or through helping yourself as well, in addition, they align together, in a simplistic yet without oversimplifying things. So we go deep into traumas, we go deep in what's causing any panic attack or anxiety or issues with a mother figure or maybe an authority figure at work. So it's not always that the boss is wrong or the boss is too bossy. Sometimes we have issues with authority figures. And so the book, How to Do the Work, it's a bestseller and #1 on New York Times for weeks now. But unfortunately, it's not yet arrived here in Dubai. It's still, it takes some time. So to end it just with a scholarly advice, I would advise you to check out how to do the work.
Thank you so much, Dr. Jaina. And now we'll take one last question, which I think is little important.
Just to add to what Dr. Maggot and Dr. Jaina said, I think it is high time that mental health becomes the DNA of any organization. It is the leadership team who have to take up the lead here. The way that we are successful in DALSCO is because of the leadership team, and they have taken so much they have invested so much in mental health. We are tied even with the third party for the mental health of workers. So I think the pandemic was a wake-up call for, to again relook into mental health.
Thank you very much, Lakshmi. And now we'll take one last question. This is from Deepak Patel. He is asking that if company is very keen to support, but an employee is not really very keen on sharing the health data, how do we deal with such situations?
I can take this question because it is really important. Thank you very much for asking this question. For sure, we have, it is actually by law, but also in terms of ethics, we have to respect the employee privacy. So for sure, any sharing of health data is the responsibility of the person, him or herself. They have to be willing to do this and share. What we can do is we can highlight to them the importance of this. So, for example, as the example of vaccination, now we see people have different opinion about vaccination. What we can do, we can never force a person to be vaccinated, but what we can do is that we can highlight to them the importance and the benefit that the person would get and the organization would get when this happened. And we share with them the compassionate approach that we are doing this. We are not getting the data in order to penalize a person or putting him in an envelope or in a box different than the others. No, we are doing this because we are caring about our people. We are supportive to you. We'd like to help everyone. We are also sharing our data because we know that it is important. By doing this and having this positive approach, I'm sure that they will be willing to get in and participate in such programs.
Thank you very much, Dr. Magid. And though we have some more questions, but since we are running short of time, we'll not be able to take these questions at this stage. But we'll definitely reach out to you with answers over mail. So thank you very much.
Good idea.
And actually more questions really mean that a lot of work needs to be done on the topic of mental health, which I'm sure we all will be doing, and every individual as the messages will take more responsibility.
Very good idea. Can I recommend that these questions to be gathered and sent, and maybe we can answer them later? Just happy to do this as well.
Sure, Dr. Megan. Thank you very much for volunteering for it. And I would really like to thank all our audience for joining us today. And at the same time, I'm very thankful to Dr. Kamal, Dr. Megan, Dr. Jaina, and Lakshmi for joining us today for this session and for giving very, very valuable information, very insightful out of your experiences to our participants. Thank you very much. Thank you, and look forward to joining you for our next webinar.
Yeah, thank you so much.
Thank you.
Thank you to all the participants.
Thanks to you.
Thank you.
Thank you all.
Thanks.
Have a lovely day, everyone.
You too, guys. Thank you.
Thank you.
Bye.